Good morning, everybody. It's absolutely fantastic to have you all here. I want you to relax, feel free to ask any questions. We're going to be as informal as possible. And it's a great opportunity with all our specialists in the different areas to get your questions answered. And so don't be afraid to just relax, and, you know, we're all friends here, okay? So this is our 8th year with Thrombosis Ireland. And what we try and do really is give the patient a voice as much as possible, but also to give you a voice, give you an opportunity to ask any questions, and we try and find the answers. We can't give medical advice as an organisation, but we can find the person you can ask. So enjoy this morning, and it's my great pleasure to introduce Professor Fionnuala Ní Fhionnuala, who's consultant haematologist at the Mater Hospital and the Rotunda Hospital. She is also the director of the Irish Network for VTE Research, and she's on several steering committees. She's on the Council for International Society on Thrombosis and Haemostasis and acts as Vice Chair of the ISTH Guidelines Committee. She is the former member of World Thrombosis Day International Steering Committee. But most importantly, Professor Fionnuala is our future national lead for VTE with the HSE. So we're delighted to introduce her now. Thank you for doing this.
I'm not allowed to put in. So what can I say? It's such an honour to be here this morning, and also such an honour to follow such an inspirational friend, colleague and mentor as Anne-Marie O'Neill. She has literally transformed the care that we give and the experience of so many people who have experienced thrombosis. It's very difficult to express in words quite how special Anne-Marie is and what she has done for thrombosis in Ireland, not just at a hospital level, but also at a national level and at an international level. So she's spoken at many international events raising awareness of thrombosis, and has literally changed the awareness of thrombosis internationally, nationally, and at so many hospitals here in Ireland. And anybody who's on social media will have seen pictures of Anne-Marie and Anne and all of their colleagues in Thrombosis Ireland literally putting packs into boxes, sending them out to dozens of different hospitals in Ireland in preparation for World Thrombosis Day, which is happening next week on the 13th of October. So I just cannot put into words how grateful and honoured I am to be here this morning to speak today at the Thrombosis Ireland Patient Conference. And it's also a joy to formally open VTE Dublin 2022, so welcome everybody. Before I start, I would love if anybody is comfortable for today to be very interactive. So some of you may have experienced thrombosis yourselves. Some of you may have family members who have experienced thrombosis. Now, there will be some people who don't want to, who would prefer to listen, but there may be people online or here in the room who might be comfortable to share their stories, or even to share how things might have been done better, because Anne-Marie and I have a lot of work to do over the next couple of years, and we are really interested in how to improve the experience from your perspective. So actually, before we even begin, I would, if you're comfortable, if anybody in the room be willing to express whether they have experienced a thrombotic event themselves. Just put up your hand. Okay, or don't. It's fine if you don't want to. And I think I see some familiar faces in the room as well. I think we may have met last year at the conference or at the World Thrombosis Day Mansion House event. So you're all incredibly welcome. So please stop me at any stage and ask questions. at any stage, if what I'm saying is relevant to you or hits a chord, please stop me. And in particular, if you can suggest anything that we as a country could have done better in serving you throughout your journey, I would really, really love to hear that. So really just to get the slides are just to get the ball rolling, but I really would love to hear from you and to share your stories. So we'll start with what is venous thromboembolism. And I think everybody in the room is probably aware of what venous thromboembolism is. Just to step back though, our mission over the next 2 years and going into the future is to ensure that everybody outside this room, everybody in Ireland, care providers, families, everybody who hasn't yet had a blood clot knows what the signs are, what the symptoms are, so that we never miss an opportunity to diagnose a blood clot in time, to do it really well, to make sure that people don't experience unnecessary complications that needn't have happened down the line, or indeed tragedy that needn't have happened. I would love to hear from you. So what was would anybody like to volunteer what their understanding of what a blood clot was, blood clot in the veins, or is now? Yes, Anne-Marie, thank you.
I suppose when I got my first blood clot, my first blood clot was after I got my gallbladder out, and it happened while I was ill in hospital. So I didn't really understand what it was. I got a pulmonary embolism. I had no leg symptoms, no DVT symptoms at all. I just knew that I had nearly died. It was very frightening. And I think that didn't help my recovery. I became like a sick person. I was afraid of everything after it happened. And I think part of the reason why I really push to do this is because I really feel that if we understand what has happened to us and we understand how to protect ourselves going forward, that we have a better chance of recovering well, both physically and psychologically. Yeah. So I had no idea what a PE was, had never heard of it.
Really?
And even 5 years after it happened to me, I still didn't really understand what a PE was. It wasn't until it happened to me again that I really started looking into it.
Okay.
So I think communication between doctors and patients is really important.
Thank you so much, Anne-Marie. And before you give up the mic, up front, what if one thing could have been done better in terms of communication, what would that have been, or what would you have liked?
Look, just behind you there we have our blood clot alert card. If somebody had given me that in the hospital when I was leaving, it's a little toolkit to explain really what had happened to me.
Yeah.
The fact that it could happen to me again, that's really important. I never knew it could happen to me again. And if I didn't know it could happen to me again, then I wasn't even trying to protect myself or making myself aware of the signs and symptoms. Yeah. So that little piece of communication to me is the key. Okay. That every patient that goes into hospital should get one, but particularly not to forget the people who have experienced a blood clot, that they need to understand what has happened to them.
And what else?
And blank.
Did anybody else have a similar experience, or... Thank you.
Hi. I had bilateral pulmonary emboli that came on unbeknownst to me. I knew I wasn't well, but I was that way and gradually getting worse, getting breathless, no energy. And then I collapsed one day, collapsed twice in the same day, and ended up in coronary care unit in Vincent's that night. And I was discharged a week later on warfarin and told, yes, you will get better. Sadly, I didn't get better. Okay. And 2 years later, I was diagnosed with almost totally blocked pulmonary arteries.
I'm sorry.
And nobody seemed to know Nobody seemed to know what was available or anything like that. I ended up going to the States for PTE surgery,
Okay.
but for that, I would have died in certainly early 1999 if it hadn't been for that.
It was back in 1998 or 97.
Well,
Okay.
it first came on 97.
Yeah. Do you mind sharing your name, or if you're not comfortable, that's okay.
Yeah, David Nisbet.
David,
yeah.
hi, David. And David, did you said, one thing you said was alarming, which is that you'd had symptoms for quite a long time before.
Maybe it had been coming on gradually.
Okay.
I found going up a flight of stairs, which
Okay.
never would have been a bother to me at all.
Yeah.
I found myself getting a bit breathless.
Okay.
And I couldn't understand this. And she, who must be obeyed, kept telling me, you're not getting enough exercise. Get out,
Okay.
get out and walk or cycle or whatever it is you want to do.
Yeah.
I couldn't.
Yeah.
Now, she knows now.
She's sympathy for you.
Because she was there every step of the way. She
Yeah.
came to San Diego with me.
Okay.
And that must have been far harder for her than it was for me. I didn't care at that stage. I was just too sick
Yeah.
to worry about it.
Yeah.
And I had to be prized out of the plane seat, and when I eventually got
Right.
there, I'd swollen up so much over the course of the journey.
And David, did you know what, on a very basic level, what a pulmonary embolism was?
No, I'd never heard
You'd
of it.
never heard of it?
No,
Okay.
I was one of these, I wasn't a particularly fit person in the sense that I was, as I am now, I was overweight. But I was able to cope.
Mm.
I worked in an office, full day in an office. I would come home and dismantle cars at night or any of those kind
Yeah.
of things. But I stopped being able to do any of that.
So it changed your life?
It was a complete and utter change.
Okay.
And if I hadn't met a particular cardiologist who had worked in the facility in San Diego
Mm.
and who was on first name terms with the surgeon,
Mm.
and I saw him on one day, fortnight later I was in San Diego.
Okay.
A week later I had the surgery, and literally a week later I was discharged from hospital.
Wow.
And a week later we flew home.
And I hope you're doing well now.
Well,
Anyway.
I hope so too.
Thank you so much, David. Did anybody else have a... Hi.
Hi, my name is Claire.
Hi, Claire.
Mine just came on me. I was.
Yeah.
It happened last August, and Dr. John Moriarty looked after me very well and
Okay.
made sure I was all right. I was coming home from Sligo. I was after driving a good bit, and my leg swelled up, and it was very painful. And the clot was in my groin here.
Okay.
And I went to that night. I was in very bad pain, so I went to I got an ambulance and I went to A&E. And they,
And Claire, did you know what the symptoms?
No,
Okay.
I had no clue.
Okay.
all I
Okay.
knew was my leg was double the size of the other
So
one.
you had no idea.
I had no idea.
Wow.
It just came on me. Yeah.
We
yeah,
have a
yeah,
lot.
yeah.
Sorry to interrupt you, Claire.
Yeah,
Carry on.
That's grand. No,
Yeah.
so I was. They put a kind of a skewer thing or something in
Okay.
it and unblocked it. But Dr. John Moriarty
Okay.
looked after me with excellent.
So you had a deep vein thrombosis.
Yeah.
Yeah. And actually, Claire, you might be the perfect person to tell us what a deep vein thrombosis is.
Well, it was just the swelling of the leg, and the pain was in my groin. So
Yeah.
but what do you call it? It was a blockage, the
Yeah,
way-
exactly, yeah.
yeah.
So
Yeah,
what Claire
but
is,
I've never nothing like that.
you had no idea
Yeah,
what this.
yeah,
Okay.
Yeah.
Thank you so much, Claire. How are you doing now?
I'm doing great.
Good,
Thanks very
good.
much. Yeah.
Thank you so much,
Yeah.
Claire.
My name's Jerry.
Hi,
I
Jim.
was diagnosed, I had COVID in March, okay?
Okay.
So then at the end of April, towards the end of April, I'd been in Amsterdam, but my foot was sore, my leg was slightly sore.
Okay.
And then suddenly my foot was very sore.
Just
not
your
my
foot,
leg, my
yeah.
foot. And I went to a physio on a Wednesday.
Yeah.
Of course, diagnosed that could have been from the back. I even went out to the VHI clinic and they x-rayed my leg. no swelling, no nothing.
Okay.
I was beginning to get a bit breathless, but
Okay.
I had, throughout my life, I've had a sort of an upper respiratory infection every 2 or 3 years.
Okay.
So that was it. But on the Monday then, my wife thought possibly pneumonia,
Yeah.
and then into the matter,
Yeah.
and incredible. You were incredible. From the moment I went in, A&E was superb. Got the x-rays, and then within 2 or 3 hours, CT scan, diagnosed it, shot me, full of the stuff, and 4 days later, I clots in the lungs and the heart, and 4 days later I was out of hospital. And this week I had a checkup which told me about this
Great.
today. But like,
Oh, good. So you heard about the.
yeah, but
And
the foot was the thing.
was the
that-
thing that's. And had you any idea what the symptom?
absolutely none. I
We
actually
have so much work to do.
What?
Yeah, we have so much work to
no,
do.
I don't. No, it's not.
Yeah.
It's not even that. I actually
Yeah.
felt. I thought it was like I walk regularly, and I
Yeah.
thought I had a sort of soft tissue.
Yeah.
And then my breathing, and it was the breathing that
Okay.
sort of. My wife actually thought but like once, like got the X-ray and stuff like that. Nothing showed up in the X-ray. I had no swelling.
That's really interesting, Jerry. So again, when as Anne-Marie and I know, I suppose, are aware that so many people in the community wouldn't know the signs and symptoms of a deep vein thrombosis or a pulmonary embolism if it happened to them. And I think all of your stories are expressing that very clearly. And how, you've all told completely different stories of symptoms. And we'll go through those later, but how it varies from potentially swelling in your leg to pain in various parts of the leg, either leg, and then you may not have lower leg symptoms at all. You may simply experience symptoms of a pulmonary embolism, without having any pain or swelling in the leg. And that is the message that we need to get out there. Did any of you feel, or anybody else who hasn't spoken, feel that we could have done more in terms of education at the time, so when you were in hospital? Or, hi. Oh, do we have just the microphone, Anne-Marie?
Oh, sorry.
Thank you.
Hello, good morning.
Hi, good morning.
I'm Andrea.
Hi, Andrea.
Just my story, I suppose, is slightly different. I got COVID at the start of December.
Right.
So I have shared my story, and Anne-Marie has it up on the page. So I suppose I was been treated for the after effects of COVID.
Okay.
So,
Last December,
yeah,
Andrea.
so
okay.
it would have lasted the full month of December.
Wow.
So I ended up in hospital at the end of December, but it was with shortness of breath. So I did chest X-ray in Castlebar. This is Mayo General Hospital
Yeah.
at the time.
Yes.
And I was told, you're fine.
Yeah.
There's nothing wrong, you're fine. You know, the way you'll be
And
grand.
did you know, had you ever heard of blood clots? Had you ever?
No,
Okay,
no.
you hadn't?
No. And I obviously left the hospital assuming, I must be okay, but I'm still feeling shortness of breath, and I'm
Yes.
feeling, quite panicky about
Yeah.
the whole thing.
Yes.
So I went to a cardiologist then, who obviously used that Holter monitor and the whole lot,
Yes.
and said everything looked fine, there was nothing alarming on it, but yet I knew myself I wasn't right. So
And Andrea, was in terms of what your baseline would have been, and exercise tolerance, climbing stairs, had that changed?
I was
for you?
floored.
Okay.
It was all put down to COVID,
I know.
and the after effects of it. So my partner had got me a trip to New York for Christmas, and at the time I was so unwell. It just, the
Yeah.
months flew,
Yes.
and the next thing we were on our en route to New York, and I remember the stairs to the Empire State Building. I couldn't do it. I really
Okay.
couldn't. Those 3 or 4 days, they were horrific.
Okay.
So after that then, shortly after that then, I got a pain in my shoulder, the top of my shoulder. And it kind of was a dull pain. Like it wouldn't be something that it'd stop you doing anything, but it's just driving the car for 2 or 3 days. That's when I kind of felt it.
Yeah.
And I was thinking, God, this isn't getting any better. And I was at work for 2 days, and I work in banking. So I'd worked for the 2 days. And that evening I was feeling really unwell, and I went to bed. And when I woke up in the middle of the night, then I had a pain that went from the top of my shoulder all down my side. So I rang Westdock at the time, and they said to me it sounded like I'd pleurisy.
Okay.
So to hang on and go to your GP in the morning, there's no point going to A&E now at this stage. This is about 6 o'clock in the morning. So I did, and I drove down to my wonderful GP. So when I landed down to her, she basically said, Andrea, you need to get to the hospital. I think we have a clot in our hands.
Okay.
Now, I drove to the hospital not knowing what a clot was or anything else, and I was still being treated as a COVID patient. So I was put through the COVID A&E unit.
Yes.
But they were fantastic in that unit, you know. But I remember the doctor. I can still remember him when the results came back. And he seemed to be more traumatised than I was. So I was kind of standing looking at him saying, you know, he said, I think we'll have a cup of tea. Now, this was in a little canteen area that he had taken me into. And I was here, okay, like still not realising what was wrong or the importance of acting fairly quick on the whole thing. Knew nothing about it.
Yeah.
Didn't mean anything to me. All I wanted to get rid of was this pain that I had. Yeah.
And Andrea, did you, since your diagnosis and treatment, how has so you don't need to share personal details of your recovery, but how was your recovery journey in terms of?
My experience in the hospital now after that, though, was horrific.
Okay.
Absolutely horrific. I was handed paperwork, I remember, when I was leaving. I know you haven't had a stroke, but there's something in that about Eliquis, and that's what you're going to be on.
Oh, yes.
And that was it. That's what I was given. And it was a Google search that I found this society.
Thrombosis Ireland.
And Anne-Marie rang me then, and it was the nicest phone call I think I could have ever got, you know, because you're very much alone.
Yes, and that's, we certainly want to change that.
Yeah.
Thank you so much.
Thank you
so much, Andrea. And even with the show, does anybody else have any thoughts on recovery? Oh, apologies.
Hi, my name is Harry.
Hi, Harry.
My experience of thrombosis started one Sunday morning. I got up out of bed and my legs, both legs, were swollen. I was like, anyone knows the Michelin Man tire figure? Yes. My legs were like that.
Okay.
Weren't particularly painful, but just totally. No, I didn't know what it was because there wasn't any pain involved. I just got on with my day. Bought my kid to a rugby match and went to see another game in the afternoon. Monday morning, I had to go into A&E.
Yes.
I was there for most of the day. Was diagnosed with having too much fluid, and was given a diuretic and sent home. Okay. And told to take that for 3 or 4 days. That wasn't working. The following day, I went back in, and I still wasn't listened to. I was sent home again. I was told I wasn't mobile enough. I needed to. I said, why are my legs swollen? He said, because you're not walking. I said, I can't walk. I said, yes. He said, that's because your legs are swollen. So he was kind of contradicting himself.
Okay. Wow.
Eventually, on the Thursday, I went back in. I have an underlying condition, which I'm seeing the nephrology people for.
Okay.
So they had a clinic on the Thursday. And on the Thursday, I went back in, and I went straight to the clinic. And Professor Mara very quickly kind of realised what was going on and started pushing buttons. Anyway, I was taken in, and I had clots in my iliac veins and inferior vena cava.
Okay.
So I had put on warfarin straight away, admitted. They decided to put stents in.
Okay.
And the night before I was getting the stents put in, I'd got a slight pain in my chest, which I told the nurse. And she said, okay, well, the guy in the bed next to you, the doctor's come up to give him an ECG shortly. We said, we can give you one as well.
Yeah.
But I actually fell asleep, and nobody came near me.
Okay. So
I had the procedure the next day to put the stents in, and I had a cardiac arrest on the table. And I had a pulmonary embolism. Straight after. So I got the PE, cardiac arrest. and ended up in HDU for 3-4 weeks.
Okay.
So,
Sorry.
so that was.
And how have you been, and how's your recovery been since then?
It was slow. It was slow.
Yeah.
It's kind of complicated because I have an underlying condition. I've fibrosis, which is retroperitoneal fibrosis, which attacks organs and stuff like that. So it's very random as to how it comes up. But it's been very, very slow and long. Now, I have seen Professor Moriarty recently, and he reckoned, thanks to Anne-Marie again, and he reckons he can actually do something for me to clear the blockages.
Okay.
So it's been a long journey, but it's not without hope either.
Terrifying.
Yes.
And again, it may not be something people are comfortable with sharing here, but certainly we're very aware that post-thrombosis, post-pulmonary embolism, anxiety and panic and post-traumatic stress is a very real feature of having a blood clot. So it's definitely something that we are keeping. The other issue that you, Harry, brought up, and also Andrea, and I don't think anybody has spoken about pregnancy yet, is the risk when you have another condition that is associated with symptoms that that overlap with venous thromboembolism. So, for example, COVID shortens the breath, pulmonary embolism shortens the breath, and kidney issues, of course, as well, with lower limb swelling. And that also arises in pregnancy as well. So, it's very common to have shortness of breath and lower limb swelling, so leg swelling when you're pregnant as well. And this is certainly an area where we need to educate. One thing that's really coming out is how few people actually were aware of the signs and symptoms, and just the fear and the terror and the, after the diagnosis, we certainly, I think, have a lot of work to do in terms of education and recovery. Thank you so much. Anne, yes.
Sorry, it's just you're talking about recovery. Sorry, my name is Anne and I volunteer with Anne-Marie in Thrombosis Ireland. But just in the last 24 hours, we've had a couple of questions in just from what you're talking about.
Oh, yeah.
One lady said she has just had a DVT and been discharged from hospital, but she wants to know, is it okay to go for a walk? Can she go to her shopping? Basic things.
Okay, the basic questions.
She doesn't know because nobody has told her. Okay. And there was another one was a lady who was going away to a nice hotel for a weekend, booked a massage, and when they filled in the questionnaire, they said, no, we can't do a massage for you because you're on blood thinners.
Okay.
So just
that's really interesting, and actually it would be, I really appreciate those questions coming in. And again, this is why communication is so important, because often as doctors, what we think is important, what we think people need to know about, may not be what is actually important to you. And so many people have said to me, I just need to know I'm okay at the time. I'm just terrified, and maybe that's your experience, or maybe it's not, but. It certainly needs to be a two-directional conversation, three-directional when we include carers. And would anybody?
I think we certainly need to know how to recover.
Yes.
If you have a heart attack, you go on a 6-week programme.
Yes.
If you have a stroke, you go out to the National Rehabilitation and they help you step by step. How do you recover?
Yeah.
But if we have a blood clot, there's no recovery. There's no guidance on how to do it. Now, we do have a leaflet on our website, and we actually have it printed as well. If anybody ever hears of anybody having a blood clot, we have a recovery after a blood clot, both physically and psychologically. And it's really important to just have those pieces of information to help you recover.
Thank you, Anne-Marie. Does anybody? Yeah. Hi,
I'm Jennifer. Nice to meet you. I've had thrombophlebitis, the infection in the vein, a DVT and pulmonary embolism.
Yes.
From 2005 until now, until last year. One of my concerns was been on the contraceptive pill for literally 18 years, and that's something that scares me and concerns me, and especially now that the HSE have put it out there for young people, and it's actually scary to think that that's probably not being spoken about, that the contraceptive pill is a part of it.
Thank you, Jen. And actually, as you may have guessed, women's issues in thrombosis is very, very dear to my heart.
My mum, when she had one, she was pregnancy-related DVT, and for me, it was because of her history. my weight, and then the pill was a factor as well.
And there are options, Jen, as you know, because contraception is so important as well. But it's a very important conversation for us as doctors to have and to be educated on, and so to make sure that people do have safe contraceptive options if they have a person or a family history. Is there anything else, Jen?
No, my first 2 experiences of clots in the hospital were not as good as my last one, which was only last year.
Okay.
And I'm a person that can't sit for long. I can't even sit here for long. And
You get up and anybody feel
I
free to
know.
get up and walk around.
But I wouldn't stay in the bed. But the nurses were freaking out, but the doctors weren't, and they were like, "Oh, let her walk."
Yeah.
Let her walk. But the nurse was like, "No, stay in bed. You're sick."
That's interesting.
And that was wrong.
That's a really interesting theme. So we need, that's really important. Whjat, thank you. Thanks, Jen.
Hi, my name's Gavant.
Hey, Gavant.
Hi, Finola. I think what kind of what's clearly emerged is maybe the knowledge of different hospitals and different levels of knowledge about the illness as well when you're being diagnosed. But I think the important thing that was maybe, it was the massage that reminded me of this, is the arbitrary information you can get from people, because somebody will say massage is okay, someone will say massage is not okay, or wear your stockings, don't wear your stockings.
That's a really important,
take the flight, don't take the flight. If you're on blood thinners, you can exercise. No, absolutely no exercise. So it just, and I would understand it varying from patient to patient, but these are advices that I would have heard from different people just about myself. And it just, it seems to vary, and you kind of have to, at the end, almost make up your own mind to decide what's best for you. And I think that's also going back to the rehabilitation things that Anne-Marie was saying, where there is set programs for certain illnesses, whereas with this one, it just seems like whatever the person feels is the best for you at the time. I know everyone's kind of suggesting what they think is the best, but then you're kind of like trying to figure it out for yourself.
Thanks a million, Gavant. And certainly with the national programme, that is absolutely something we will be taking very seriously. And education is coming up as a common theme. Hi, how are you? Don't worry. Thanks so much.
I had an operation. I only got diagnosed a couple of weeks ago.
Oh, God.
And I had an operation, my knee dislocated, but they wouldn't leave me out of the bed. And then a couple of weeks later, I got the clot.
And Sheila, did you, and I'm just seeing your name tag, but do you mind me using your name? Apologies. Were you, when you left the hospital, did you know what the symptoms of a blood clot would have been?
Well, the doctor that operated on me, he was worried about me having a blood clot. So that kind of made me alert to it. And
Brilliant.
But all it was like a very bad cramp that wouldn't go away in my leg. And when I went in, then they just told me that your doctor will take care of it. So I went back to my GP, and she said, "Well, you don't know nothing about it." And I was like, "All right." And I have menorrhea as well, so I'm on tablets to stop that, and I'm on blood thinners, so I'm on vice versa.
So Sheila, you've brought up a crucial point as well, which is that, and we'll be talking about this more, I'll be talking about this more in the nursing session later on, and later on today if we have time, that when you're a woman and you have menstrual periods, I'm saying we as doctors have a responsibility to make sure that we talk to you about the effects of blood thinners on periods, particularly if they're heavy already. And to make a personal plan, and I know that doesn't. So education again, big thing.
They've kind of discharged me because they just put me on Primalute, the pill, the coil, a whole lot of other medication to stop it.
Thank you, Sheila. That's a really important theme, and I'm sorry it happened to you, but I'm glad your surgeon was aware of it.
Thanks.
Thank you so much, Sheila, and thanks to so many of you who've travelled to be here today. Any other themes that we haven't? So we've got awareness, education, long-term recovery, the basics. The questions that actually to me are so easy to address, but I wouldn't have thought about, and that's why it's so important to talk. Any other themes? And we talked about, pregnancy and the pill and heavy periods while on anticoagulation. Any other themes that you felt weren't addressed already? I'll just check the time as well. Anne-Marie, are you sure? Oh, okay, we'll move on. So I think we've covered very, very clearly from everybody's stories, for which I'm immensely grateful, what is a venous thromboembolism. So it's obviously a clot in the veins, which can happen in either leg, more so in the left if you're pregnant, very much so, but in either leg, below the knee, above the knee. We've heard stories of both experiences, which can then travel, travel through those veins up through the inferior vena cava, up into the blood vessels around the heart and cause a pulmonary embolism. And again, this is why awareness is so important, and why our top mission for the programme is to ensure that everybody receives an alert card who hasn't had a blood clot yet, and who has, but, so that nobody experiences a deep vein thrombosis, for example, without having the opportunity to get that checked out and potentially prevent a pulmonary embolism. Because as Jerry, has pointed out, a pulmonary embolism can have lifelong complications, such as chronic thromboembolic pulmonary hypertension, such as post-thrombotic anxiety, long-term dyspnea, which is shortness of breath, inability to exercise, change in life. So if we can prevent all of this, we absolutely have, it's beholden on us to do so. So I think that's my job, that's our job, but if you could help in terms of spreading the word and informing and making sure that anybody you meet is aware of, is aware of the symptoms and the signs of a blood clot. That'd be terrific. So we'll move on. So again, I think this infographic stopped me in my tracks when it was published by the World Thrombosis Day Committee a couple of years ago. They had done a really, really big survey, and I think your experience really reflects that, here are some of the signs and symptoms of a deep vein thrombosis. You all know what they are, but you didn't know what they were. A lot of people, a lot of you here today and a lot of people around the world wouldn't have known what those symptoms were. And in this survey, only half of Americans were aware of the signs and symptoms of thrombosis. We don't have formal data of that scale yet here in Ireland, but I suspect the figure is at least as low, if not lower, and we need to change that. And again, the same thing goes for pulmonary embolism, and that's potentially even more worrying, because a pulmonary embolism can either be tragically fatal or it can lead to long-term life-altering complications that require intensive surgery sometimes and lifelong blood thinners. So if we can prevent it, let's do it. And again, all of you have highlighted very nicely the signs and the symptoms. It is not difficult to remember these signs and symptoms if you are somebody who's been in hospital, but if you haven't heard about them, then we will miss an opportunity to help you. So shortness of breath, rapid heart rate, chest pain, again, you highlighted very nicely that it can be a particular type of pain that when you breathe in, it catches you, it's sore, but that's not necessarily the case. Is there anybody who hasn't spoken who'd like to come in? Oh yeah, thank you. Yeah.
I'm Joe.
Hi Joe, how are you?
How's it going? Can you hear me? Hello? Yep. Yeah. I had a pulmonary embolism in January 2020. Okay. I was in for I had previous abdominal surgery in 1999, and I got a hernia on it. It was kind of surgical thing. So I was having that repaired. And they found that I had an obstruction in my bowel during the surgery. Okay. So the surgery went on for a long time. Okay. And when I came out of theatre, I was lying in the recovery room and I was very sick and I was vomiting and just felt awful, really, And next thing, I just couldn't catch my breath. Okay. And I just said to the nurse, I said, I have terrible trouble with my breathing. I don't know what. And it was like I hit the atomic button or something like that. The minute I said that to her, they came in from all angles. I was taken out, the bed was taken down for a scan, and I was put into intensive care. I spent a week in intensive care. Wow. And but I'm fine for it. I mean, it's all history. I've gotten over it. I was a month in hospital, but I couldn't walk after it, and then I lost my speech, which has obviously come back. But and I'm off medication now.
Okay, good. And did you know the symptoms of a blood clot?
I'll tell you, I had experience of it.
Okay.
My brother in 2010 died suddenly, and the post-mortem said he had pulmonary embolism.
So sorry, Joe.
But the thing about, I still knew nothing about pulmonary embolism.
Oh, okay.
You know, it meant nothing to me, and I thought it's not going to happen to me.
I'm really sorry.
And then that was I had January 2020, and in March 2020, my sister who lives in the UK, she had pulmonary embolism. Okay. So I know I was saying to Anne-Marie there, a question I wanted to put to you was that apart from all that, I had trouble with my knee, and I torn meniscus.
Okay.
And I was with the consultant for my knee in September. And the very first thing he said to me, he said, I see you had a PE. Before he mentioned anything about my knee, he was more interested in the PE.
You're good.
How did you get, how did that happen to you, you know?
Yeah.
And then he said, look, Joe, the way it is, in normal circumstances, you're a perfect candidate. It's not working, I think. Oh, yeah. You're a perfect candidate for surgery.
Yes.
But the fact you've had a PE, he said, I wouldn't touch it.
Oh, okay.
So, I mean, that was the question I wanted to put to you. Does that mean that no doctor will...
So, Joe,
don't entertain
maybe
me,
this isn't the right forum, but I probably need to know a lot more about your circumstances.
Yeah, absolutely.
It would concern me a little bit.
Well, that was part of it. I thought maybe I'd like to talk to you on a one-to-one basis or something like that, or
we'll figure it out.
Yeah.
And it's but one thing that I like from you, well, a lot. About your story, but one thing is that he was so, and again, this echoes because of how good the orthopaedic surgeons were during your campaign, Anne-Marie, that the orthopaedic consultant was completely aware of that risk and was able to see that you had additional risk factors, which of course so I'll just move on, and we talked about the alert.
No, actually, when I was getting the MRI scan done on my knee, my GP said to me, he said, there won't be any problem. He said, they'll be aware of your situation.
Yes.
So they put you back on a Pixaban, you know.
Yeah.
But, I mean, he didn't react like that, you know.
Okay. Thank you so much.
So this is another theme.
Yes.
So if you've had a blood clot, does that mean nobody touches you going forward? No matter, we have to look after our quality life at the same time as well.
Yeah.
So this is there's an education piece there.
Yeah, and you're absolutely right, Anne-Marie, and there's probably no one size fits all here, but the key thing we need to do is to ensure that individualised, personalised decision making is made, where we figure out a plan. Sometimes we just can't for whatever reason, but so that everybody has the opportunity to have a plan figured out potentially if it's safe. So we need to be safe first of all. But you're absolutely right. That is a theme that I don't think we include in our education at the moment. So thank you, Joe. And actually, I just flicked forward to this slide because Anne-Marie is giving out to me. I only have 5 minutes left, but you've highlighted very nicely one of the risk factors for blood clots, and this is another thing that is on the Thrombosis Ireland alert card, which should be given to every hospitalised patient. So being in hospital for an extended period of time, so many of you experience that. Having surgery, especially hip, knee and cancer-related surgery. So if you have had, in particular, a cancer diagnosis, your chance of developing a blood clot is far higher. And it's certainly one of the risk factors that we highlight on the Thrombosis Ireland alert card. And of course, all of you have a personal history of blood clots. So it's a risk factor. It's a risk factor we need to be aware of. It doesn't mean that you can't have, as a blanket rule, it doesn't mean that you can't enter into circumstances where your risk is higher if that circumstance will make your life better. But we do need to manage that risk and make sure that you're safe. Hi.
Just on the surgeries.
Oh, I'll just get you a microphone.
I've had 2 surgeries since I've been diagnosed with 2 hearts.
Great, yeah.
Thanks.
Hi,
I'm Brenda.
Hi, Brenda.
I've had 2 surgeries. Since then, I've had both my hips replaced.
Okay.
and I went off the blood thinners and did injections for 3 days.
Thanks, Brenda.
So, my sister also passed away in 2007 from a PE.
I'm so
I was
sorry.
completely, we didn't know. She had all the classic symptoms and we didn't know.
Sorry.
So when I knew, and the second one I got was in last year, and I knew my legs swelled up, and I got a measuring tape out and it was twice the size. So I went straight down to the A&E. So I've had quite a bit of history, and my other sister had one after surgery. But my brother is fine.
Okay.
You know, so
My condolences.
yeah, but like I did have the surgeon I had in Vincent's, Alan Malloy. He was fantastic.
Yeah.
Yeah.
And Brenda's story is precisely what we can do, and there is
There is
a
able
way
to do it.
Yeah.
You know, but it's just different.
Yeah.
Everybody's different.
Yeah, everybody's different, and there's no one size fits all. But there is a way of interrupting anticoagulation in a safe manner, if it's safe to do so.
So there is
I'm
that
so
hope
sorry.
there for after.
Thank you. There's somebody at the.
Just reading on the internet about COVID.
Yes.
COVID and long COVID and the risks of clots.
Yes.
In the time after. So
Yeah.
that anybody who's had COVID should really be recommended go straight on to your mini aspirin or something. Would you say?
Well, that's a really interesting question, and that's certainly something that was thought initially. But actually, one thing about COVID is that it really rallied the international community, the scientific community, to answer questions properly through randomised controlled trials. And actually, so it's been shown that if you're in critical care, you're very unwell with COVID, you certainly do have a 1 in 5 chance of having a blood clot. But that doesn't mean that somebody who's out of the hospital, who's not admitted to hospital, should be on a blood thinner or aspirin. That's been shown in trials. And we've never seen properly conducted, excellent trials being done in quite so rapid a time frame. So it's, for once, I can actually answer that question properly. But we do need to raise awareness. So we worked really hard with Anne-Marie and with colleagues in the HSC to raise awareness of blood clots. So you don't, we don't need to rush into taking blood thinners, which of course have risks, as you all know, and they're great when used in the correct scenario, but can be risky if taken in the wrong scenario, and it's all about balancing those risks. But the one thing we need to do is to never miss an opportunity to be diagnosed with a blood clot if you have COVID. So if you have COVID and you're at home and you're not moving around and you become dehydrated, you may have an increased risk. You know, it's probably, within, it's not listed here, actually, apologies, but being dehydrated and not moving around is, of course, a risk. It's not so strong a risk that we should start a blood thinner, which can have its own risk, but we absolutely need to be aware of the signs and symptoms of a blood clot and seek medical attention in that scenario. But thank you, that's a brilliant question, because it's lovely to be able to answer it with proper data. Yeah, thank you. And of course, other important risk factors are pregnancy, so we'll finish now. But I just want to show for Sheila that I will just flick through all of this, that when you are a young woman and you're on anticoagulation and you have periods, we do know that anticoagulation, of course, treats blood clots extremely well and saves lives, but also it comes at a cost of an increased bleeding risk, and that's okay. But for women, we have particular additional risks that sometimes can be overlooked, and I know that's the case. And particularly some of the DOACs, so I know rivaroxaban can increase that risk in particular. So for example, if you have heavy periods already, maybe that medication isn't quite the right choice for you, and maybe a different medication might be a better choice. It doesn't mean that you can't take medication. Of course you can. There are going to be options, but it's really important that we do the basics first of all, Sheila, and look for, fix any low iron, because that can, of course, affect your quality of life and make you completely miserable. Make sure that there's no, underlying gynecological reason for the bleeding. But then think about, is there, based on data we already have, is there a better blood thinner that might be more suitable for somebody who has heavy periods? Could we do something else? Could we recruit you to a clinical trial, which there's one that we're about to start in the matter through a collaboration with our colleagues in Amsterdam. So there are options. And again, that's a lovely theme that's come out, that we need to be aware of the risk, but not terrified of the risk. We need to manage the risk and formulate a plan together that is good for you. And at that, I will finish. If there are any final burning questions, I'd be absolutely delighted to take them. But yes. It's a great question.
Do you have to stay on blood thinners for the rest of your life when you had a
great
blood
question.
clot?
And this is personalised. And it has to do with some things, in particular, what the circumstances were when you first had your blood clot. So, if your clot was provoked, for example, by a strong provoking factor, then we know from data that if you stop your blood thinner, you have a very low chance of having another one, all else being equal. There could be family history, there could be something else, but in general, your risk is low. In contrast, if your blood clot happened out of the blue, or happened, in the context of a condition that isn't going to go away, then if we stop your blood thinner, you have a higher chance. So for somebody who's had a blood clot out of the blue, called an unprovoked venous thromboembolism, unprovoked PE, we know that if we stop your blood thinner, you have maybe a 25% chance at 5 years of having another one. And that's okay, but it's just knowing that risk. We never say lifelong blood thinners. Yeah. So it's indefinite. And by guidelines, what guidelines mean by that is that we evaluate, that we look at that risk, the risk of having another blood clot, the risk of the anticoagulation to your quality of life, and your risk of bleeding every year, and we make sort of a repeat risk assessment every year. So it's a straightforward enough question, but...
You see the doctor every 6 months. So
yeah, exactly.
Yeah.
Sorry,
Thanks,
Claire.
Can I just ask that?
Yes.
My 6 months prescription
Yes.
of medication is up in 2 weeks' time.
Okay.
So who makes that decision for me?
Yeah, so your GP should reissue the prescription.
Okay, now she said she wouldn't be comfortable doing that. She's
Right.
referring me to a haematologist.
Okay, and that is another really important theme that we need to, and this is I think something that we need to work with the HSE on, that we have those appointments available, not just in certain hospitals, but all around the country, to ensure that people have their follow-up appointment in a timely manner. And we can figure that out offline if you like. Yeah, it's the... Where are you from?
Mayo.
Mayo, you said, sorry, you said that already. Yeah, okay. Because it is really, that for me is a really important theme. Yeah. And of course, it's not fair that somebody is left in limbo. It's not safe, it's not appropriate. So it's a really important question. Yeah.
Thank you.
Is my time? Apologies for taking up too much time. And it was a pleasure to speak to you. Thanks a million.